Hello everyone, welcome to Alacrity Explains Medicine. Today we are going to be looking at bioavailability in pharmacokinetics. So bioavailability, which is represented as F, is a fraction or percentage of an administered dose of a drug that reaches systemic circulation in an unchanged or active form. It reaches systemic circulation in an unchanged or active form. So it's a measure of the rate and extent of drug absorption into systemic circulation. It gives you an information of how well a drug is being absorbed into systemic circulation. This bioavailability is expressed as a fraction or as a percentage. So as a fraction, it will be between 0 to 1, for 1 being 100% bioavailability and for 0 being 0 bioavailability. You can have values within 0.9, 0.5, 0.45 and the like. So what is the formula for bioavailability? Bioavailability is the amount of unchanged drug reaching systemic circulation divided by the administered dose multiplied by 100%. So the value, the bioavailability is expressed in percentage. So in pharmacokinetic studies, bioavailability is said to be the area under the curve for the oral drug divided by the area under the curve for the intravenous route of administration multiplied by IV dose divided by oral dose. So the area under the curve for the plasma concentration time curve, that's what AUC stands for, is the area under the plasma concentration time curve. So it reflects the total drug exposure. So the characteristics of bioavailability that you need to know is that for intravenous administration of a drug, intravenous administration has 100% bioavailability. This is because the drug is delivered directly into the bloodstream, because we are using injections to deliver this blood into systemic circulation. So directly the blood gets into the blood vessel, goes directly into the blood vessel. So it's entering the systemic circulation directly. While for oral drugs, they have a bioavailability of less than 100%. This is because of incomplete absorption or first pass metabolism. For first pass metabolism, the drugs are metabolized either by the liver or in the intestine before they get to systemic circulation. Or for incomplete absorption, for drugs that have limitations to their absorption, either because of their solubility or because of their molecular size or the particle size. So bioavailability may differ between different formulations of the same drug. Different formulations of the same drug may have different bioavailability. Let's say you have drug A, and this drug A is given in form of tablet, and this same blood A is given in intravenous through IV, that's in liquid form. In liquid form. Now, these two drugs, these two formulations, despite from the same drug, will have or may have different bioavailability because of the nature of the drug. So let's talk about the factors affecting bioavailability, and we're going to start with the drug-related factors. For drug-related factors, the first we have is the drug formulation. Like we said, it's if the drug is in tablet form, is in capsule form, is in liquid form, is in sustained release, all this determines the bioavailability. So the more difficult it is for this drug to be released in an unchanged form into systemic circulation, decreases bioavailability. So whether for capsule or for tablet, there's a decrease in bioavailability depending on the type of drug or the route in which the drug is being administered. Well, let's talk about drug. We have drug solubility. Now, drug solubility, the higher the solubility of a drug, the higher the bioavailability. The lesser the solubility, the lesser the bioavailability. We have lipid solubility. Now, when a drug need to cross a barrier during absorption, when we talk about absorption, drug cross a barrier through passive diffusion. Now, this barrier, we have the cell membrane of the cells lining the body surfaces, as well as the gastrointestinal tract. Now, these membranes are made up of phospholipid layers. They are lipid-rich layers. So because of that, drugs with high lipid solubility are going to be absorbed faster and to a greater extent compared to drug with low lipid solubility. So lipid solubility is also a criteria. We have the chemical stability in gastric acid. If this drug is being destroyed or dissociated into an inactive form in the stomach, if the drug is given by oral route and this part of this drug is being destroyed in the stomach by gastric acid, then this drug will not get to systemic circulation in an unchanged form, and that decreases bioavailability, or in an active form that will decrease bioavailability. We have particle size. The larger the size of the particle, the lesser the bioavailability. We have the degree of ionization. We have molecular size similar to particle size. The higher or the larger the molecular size, the lower the bioavailability. So now we have looked at the drug related factors. Now let's look at factors relating to the patient. For example, we have gastric emptying time. If there's increase in the duration at which food that passes through the gastrointestinal tract leaves the time it takes. So the longer food stays in the food as well as the drug stays in the gastrointestinal tract, increases it decreases the gastric emptying time, the time it takes for food to leave. So if the time it takes for food to leave is higher, which means it increases the duration at which food is staying in the gastrointestinal tract, and it also increases the rate of absorption of that food, therefore increasing bioavailability. But if the gastric emptying time is increased, that means there's a decrease in how long the drug stays in the gastrointestinal tract, and also decreases the bioavailability. We have intestinal motility. This is similar. You have an increase in peristalsis. Increase in peristalsis is going to what? Is going to decrease the gastric emptying time, which this will cause what? When you decrease the an increase in peristalsis is going to increase the gastric emptying time. An increase in peristalsis is going to increase the gastric emptying time, and when this happens, there's going to be decrease in the duration of the drug in the gastrointestinal tract, resulting in a decrease in absorption and a decrease in bioavailability. We have gastrointestinal pH. Now, the pH of the gastrointestinal tract determines the rate of absorption of a drug, because there are drugs that are absorbed. For an acidic drug, it is going to be better absorbed in a region with a low pH like the stomach. For an alkaline-like drug, is going to be absorbed in a higher pH like the intestine. So the gastrointestinal pH, the pH of the intestine, determines the rate of absorption. For a drug that is acidic, let's take for example atropine, and this drug needs to be absorbed, is absorbed faster in the gastrointestinal tract. And for a patient with achlorhydria, that is decrease in the secretion of hydrochloric acid, the patient will have a high pH. There will be a high pH in the stomach, which will decrease the absorption of acidic drugs as well as decrease bioavailability. The presence or absence of food. There are certain drugs that their absorption increases in the presence of food, or the absorption decreases in the presence of food. So the presence or absence of food also determines bioavailability. Talking about age, we have extremes of ages where we have neonates, we have the elderly. So depending on which extreme one is, the age of an individual also determines the rate of absorption. So the rate of absorption of drugs is different for different extremes of ages. So how old the person is determines the rate of absorption. Talk about pregnancy. This is another factor that determines bioavailability. We have liver disease. Remember, the drug is metabolized it undergoes first pass metabolism in the liver. So the first pass metabolism, in the case of liver disease where the liver is not functioning, there is going to be decreased first pass metabolism and increased bioavailability of a drug. In terms of gastrointestinal disease causing malabsorption, there is going to be decreased absorption as well as decreased bioavailability. Now let's look at metabolic factors. For metabolic factors, we already talked about the first pass metabolism in the intestine. So we know we have first pass metabolism in the intestine, we also have first pass metabolism in the liver. So for first pass metabolism in the intestine, we have like the P glycoprotein, which is responsible for pumping out drugs. So this decreases the amount of drug that reaches systemic circulation. That decreases bioavailability. For first pass metabolism in the liver, it also decreases bioavailability. For enzyme induction, there are drugs that increase the CYP enzymes in the cytochrome P450 enzymes in the liver that are responsible for metabolism of drugs. So that if there is enzyme induction, this enzyme induction increases the metabolism of this drug as it passes through the liver, thereby decreasing bioavailability. For enzyme inhibition, there are drugs that inhibit the cytochrome P450 enzymes. So this inhibition of these cytochrome P450 enzymes decreases metabolism of most of these drugs, as well as increasing bioavailability. So drug interaction, we already talked about food drug interaction, when there are certain foods that increase or decrease the absorption of a drug, thereby directly affecting bioavailability. We have drug interaction affecting absorption or metabolism. There are certain drugs that affect the absorption or the metabolism of other drugs. This way they affect bioavailability. We have drug altering gastric pH as well as gastrointestinal motility, which we have already talked about. Now, what are the routes of administration and how does this relate to bioavailability? We have intravenous route of drug administration, and here we say we have 100% bioavailability. We have intramuscular route, which is usually higher but less than. Bioavailability is high but is less than in intravenous route. We have subcutaneous route, which has a good bioavailability, but it depends on the tissue's blood flow, which means an increased blood flow increases the absorption of a drug as well as increases bioavailability. We have oral route, which is variable and often reduced by incomplete absorption of that drug or due to first pass metabolism. We have sublingual route, which is high because it has a high fast pass bioavailability because it bypasses first pass metabolism. We have buccal, which is also high because it bypasses first pass metabolism. We have transdermal, which is high and sustained, it bypasses first pass metabolism. We have inhalational route, which is rapid, there's rapid absorption with a high bioavailability. We have rectal, which is variable, there's lower in the rectum, partially because of the rectum is partial. There's a partial bypass of first pass metabolism, about 50% compared to the intestine, the absorption in the intestine. So rectal route, there's a variable bioavailability. Now let's talk about causes of reduced bioavailability: poor gastrointestinal absorption, drug destruction by gastric acid or digestive enzymes, extensive first pass metabolism, drug interaction, food interfering with absorption, malabsorption syndromes, vomiting or severe diarrhea, poor drug formulation or instability of a drug will cause reduced bioavailability. What is the clinical importance of this knowledge? Now, when you know the bioavailability of a drug, it determines the appropriate dose for a particular drug. If you have, you want to give 50 milligrams of a drug, 50 milligrams of a drug, and you know that 50% of this drug is going to undergo first pass metabolism. If you know that 50% of this drug is going to undergo first pass metabolism, we are going to lose 25 milligrams of about 25 milligrams of this drug, the initial dose. That means most likely only 25 milligrams of this drug will get to systemic circulation. But you want to maintain a plasma concentration of about 30 milligrams, which means you will have to adjust the initial dose so as to be able to achieve, maybe you give 60 milligrams so that you'll be able to, when there is loss of 30, which is half, 30 milligrams, you now achieve 30 milligrams in plasma. So it determines the appropriate dose for a drug. It helps to compare different dosage forms and formulations of a drug. It guides selection of the route of administration of a drug. So if a drug needs to reach systemic circulation faster and at a higher concentration, that drug is better given as intravenous route than given in oral route. So it explains why oral doses are often higher than intravenous doses. Bioavailability explains why oral doses are higher than intravenous doses. It's important in designing the dosage regimen. It's important in designing dosage regimen. It's essential in evaluating generic drugs and therapeutic equivalents. It helps to predict therapeutic efficacy and toxicity. So bioavailability versus bioequivalence. You have heard this before. Bioavailability, like I said, it measures the rate and the extent to which a drug reaches systemic circulation. When we talk of bioequivalence means that two pharmaceutical products have a similar bioavailability, thereby producing comparable plasma drug concentration and therapeutic effects when given at the same dose under similar condition. Same dose under similar condition. Two pharmaceutical products having similar bioavailability, producing a comparable plasma drug concentration and therapeutic effects when given at the same dose under similar conditions. Drugs with high bioavailability, these are notable examples: diazepam, levofloxacin, metronidazole, fluconazole. Drug with low bioavailability, we have nitroglycerin, lidocaine, morphine, propranolol, and verapamil. So method of improving bioavailability: use formulations that are with better dissolution, easily better dissolution. They are administered by routes that bypass first pass metabolism, like sublingual, transdermal, intravenous. You modify the drug formulation. For example, you give nanoparticles or liquid-based formulations to increase bioavailability. To protect acid-labile drugs, using enteric coating. For drugs that are liable to destruction by gastric acid, you give them an enteric coating. You reduce first pass metabolism where appropriate. So thank you for watching. Don't forget to like, comment, and subscribe to Alacrity Explained to medicine. Please don't forget to share this video to friends and classmates. Thank you.